Welcome back. We will now begin consideration of Bill number 129, the Medical Profession Amendment Act 2023, Clause 1, short title. Minister Merriman is here with his officials. I would ask that the officials please state their names before speaking at the microphone. Minister, you can introduce your officials and make your opening remarks.
Don't have any opening remarks. I think we covered this off in the House. My officials can introduce themselves. I think we have a limited amount of time, so I'll turn the floor over to the committee.
Thank you, Minister, and we'll open the floor for questions, and I recognize Ms. Mullen.
Thank you, Mr. Chair. Oh, that's pretty close. Thank you, Mr. Chair, and to the Minister and officials for being here tonight to answer some of these questions. We have chatted about this a little bit in the House already, but this bill seeks to create the role of physician assistant in the province, make sure that all of that works within the legal framework and the regulatory framework of the province. And the goal is to bring this profession in a structured way. I wonder if the minister can speak to why physician assistants were chosen as a necessary component of the healthcare team right now.
Thanks for the question, Ms. Mowat. This was actually brought to me by the Dean of Medicine, Dr. Preston Smith. He mentioned that this was another tool that was out there in Canada, and other provinces were using it as far as a clinician in a forward-facing position that we didn't have in Saskatchewan. He suggested that we have a look at this to see if it was something that could fit into our complement of great healthcare workers. And he committed that if we would look at it, that he would look into it from the College of Medicine as far as the regulation of it under the physicians. And we had some preliminary discussions, went through our process, and thought that this was something that was effective in other provinces. And we thought, as in the past with other professions that have been introduced and scopes that have been expanded over the last few years, we wanted to maximize, see what other provinces are doing, glean information from them, and see how we can take that and apply it to Saskatchewan. So we're very excited about this. We've had some very positive feedback from the SMA, mostly from physicians that have interacted with physician assistants and understand the value that they are within the system and how much they complement doctors in their role. So it's something that's very exciting to them. For physicians that have not worked with physician assistants, it's an opportunity for them to showcase their skills in assisting doctors and forward-facing to the patient. So it's a very good opportunity for us.
Can you speak to the scope of a physician assistant and how it might differ from other healthcare professionals within the complement right now?
Sure, maybe I can describe some of the duties that a physician assistant or PA will be required to do within their operating. Conducting patient interviews and taking medical histories, physical exams, ordering and interpreting tests, which I think is very important, prescribing medications, formulating treatment plans as part of the primary healthcare team, providing patient counseling and preventative health care, assisting in surgery, and performing other tasks within the supervision of a physician's scope. So again, under the direction and the supervision of a physician, they will be able to operate and deal with all of those preliminary analysis that a physician would normally do, because what we want is a physician to be operating as all positions within our healthcare system at the top end of their scope. This is something that will assist and elevate physicians to the top end of their scope, so they do not have to be bogged down with some other processes, such as something that could be very simple as taking a patient history, ordering and interpreting tests. That's something that can be done for the physician assistant, so the physician can move on and do something that is at the top end of their scope.
In terms of that job description, how would that compare to the duties of a nurse practitioner or an RN? You know, where would the overlap be there?
There would be a lot of overlap. The difference between, and I've been trying to explain this in the media, is a nurse practitioner can operate independently from a physician, where a physician assistant has to have the supervision of a physician on the final call on what they are doing. Now, that supervision can be virtual, can be in person, can be a video call. It could be just a verification simply of a physician just verifying what the physician assistant has done. But they're trained under two different models. One is obviously under a nursing model, and the physician assistant is trained under a physician model and under that scope. So I can go through some of the nuances. There's many differences between the two positions, but I could also get a copy of this cleaned up and submitted to the committee and to the differences of the two positions, because there is some clarification that has to be done in the general public, and we're working with the National Association of Physician Assistants so they can do some public relations and explain this to people that, especially in the medical community, that have not worked with a physician assistant before. So we're heavily relying on them. They're very supportive. I believe, well, last time I spoke to them, the gentleman that was in charge of the Physician Assistant Association, or the national, was actually from Moose Jaw and couldn't find a job as a physician assistant and had to move to Winnipeg, unfortunately, because there was no position here for them. So, and his response was, if there's physician assistants are allowed in the province, that he would definitely be moving back to his home province to be able to practice.
In terms of the overlap that exists with nurse practitioners, I wonder if you can speak to the differences in training between NPs and PAs, as well as what the base salary might look like.
Okay, I can certainly go through the education. Okay, just making sure I get the up-to-date. I'll start with the physician assistant and go through it. There's 4 bullets on each side here. So again, the physician assistant is educated in a medical model. They have a bachelor or master's degree in physician assistant studies. Regulation is dependent on jurisdiction. They practice in all areas of medicine through their scope of practice, although their scope of practice is based upon their scope of supervision. A nurse practitioner would be educated in the nursing model and a medical model. They would have a bachelor's in nursing, followed by a master's in nursing degrees for nurse practitioner studies. They're regulated under the healthcare professions by the College of Registered Nurses of Saskatchewan. Independent practitioner with the scope of practice and practicing in all areas of nursing. As far as salary, just give me a second on that. just maybe cover, just in the, we will only have a limited amount of time here. I'll go through a couple of the dollar amounts. We have budgeted this year $1.3 million for 12 positions. That is prorated because we knew we wouldn't get the the physician assistants in immediately. So we have $1.7 million annualized for those 12 positions. We will have to sit down and negotiate what the exact salary is because that hasn't been set yet. There's a few things that we have to go through with labor relations just to make sure that that is set. And a nurse practitioner, we're just checking on the salary, but it would be, I think it's negotiated in and around $100,000 plus or minus a bit, depending on their experience and where they are in their practice.
Do we know exactly which clinics these 12 PAs will be placed in yet? Or I think maybe communities were listed previously, but...
Yeah, we don't have the exact communities. We're going to sit down and see where we have gaps in service and see if we can fill in those gaps with these. Now, these aren't going to fill in all of the gaps, but it is certainly going to help out. They're definitely, again, they're trained similar as an Army medic, so they would be very good in triaging individuals in emergency room situations. That type of scenario would be one of the things that we would be looking at for these positions to be able to help out our system.
Oh, okay. I was under the impression that they were going to go to primary care clinics. That's not the case?
No, they would be going to some primary care clinics as well. Yeah.
Is there a breakdown of...
We haven't determined that yet. We've got to go through this process, but sorry, I just got an update on the NP's salary ranges in it, again, from that 100 to 120.
So there isn't a breakdown of where they are going. How was the number 12 determined? Or the dollar amount determined then?
I think it was more on the budgetary dollar amount versus the actual positions, but we wanted to start this process off slow and grow it versus, again, we have a finite amount of dollars in health and we had to allocate money to surgeries, to primary care, physicians, nurses, and adding this complement in, obviously it's an additional cost. So we wanted to make sure that we'd had spread our healthcare dollars to all areas of healthcare and not just focus in on one area. And we have some educating to do within our clinicians so they understand the role of this. So we want to start small, and it'll be something that we'll be looking at growing over the years to come.
Is the placement of these PAs, is it going to be, like, do clinicians need to apply to be one of the recipients of a PA, or what is that process going to look like?
I think we would work with clinicians especially the ones that have some experience in this, for them to be able to talk to their colleagues and see what the opportunities. But again, we will also want to work with the primary care team to identify where there are gaps. It's not just if you apply and ask for a physician assistant, you're going to get one, because we need to plug these individuals in to stabilize primary care, as well as if they are in any of our larger tertiary centers that they're integrated in there. Because anytime you bring a new position into an organization, we have to educate not just the individual and how the system works, but we have to educate the staff on what this role of this position is going to be and what they can and cannot do. So there's going to be a little bit of a learning curve here. Again, that's why we brought in a small number, just to slowly integrate this into the system versus overwhelming, because we are bringing in lots of nurses as well from Saskatchewan, from the Philippines, doctors, so we don't want to overwhelm the preceptor side of things as well. So,
is there an idea that these individuals will be placed under salaried physicians or fee-for-service physicians?
Thank you. It's going to be kind of to be determined. We're going to see exactly where this fits into the overall system and make sure that, again, we're integrating in a way that's going to work for everyone. So on the fee for service versus the salary, right now we only have one or group that has fee for service, which are physicians that I'm aware of. Just checking here. We wouldn't, we would have to weigh that out, and we'll have to see what is in other provinces, and again, work with the National Association to see what has worked best in other provinces. It's more of a to be determined right now.
Recognizing that there's a lot of TBDs, when do we anticipate having these folks in place on the ground?
As soon as possible. We've got a few things to work out. We wanted to make sure that it saw its due process through the legislative process, and once that's done, there's lots of work happening behind the scenes with our human resource strategy, as well as our recruitment agency to determine these. Again, we're continuing to work with the association throughout this process so they can inform us, but nothing has been finalized. As soon as we do finalize it, we will have the physician assistants on the ground, the positions bid out, but we want to do it in the proper process to make sure that it is done, that there aren't any hiccups or any labor issues.
I think one of the central questions that I've received or heard in response to this legislation is where are these folks coming from and where are they being trained? Where do we identify a labor pool that we are going to be able to recruit from, given that we don't have that training capacity within our province?
The rough numbers is there's just over 900 of these across the country, physician assistant positions, the majority of them in Ontario, some practicing. There are 2 schools, I believe one in Manitoba and one in Eastern Canada, I'm not sure. Dalhousie?
Yep, that's a new one.
Dalhousie is doing a new one. University of Manitoba and McMaster, and Consortium of PA Education at the University of Toronto. But I think at some point in time, the Dean of Medicine has indicated that they would look at potentially expanding their college to see if they could train physician assistants within Saskatchewan, because ultimately if we can train our own, but I don't want to preempt the process that he has to go through. Right now, we've got the regulations in place. Now we'll have once this is passed, we'll have the legislation in place. And then if down the road we want to look at developing an in-house program within our province, I think the government would be open to that. Obviously, there's financial implications on that, but if we can grow our own within the province, we certainly love to be able to do that.
Is there a sense that that there's folks who have been trained as physician assistants that are not currently working, or is the goal to approach these educational institutions to recruit those folks?
I would think we'd be looking at both of recruiting new physician assistants, but also experienced ones that are out there. We want to be able to put a competitive dollar out there, so a physician assistant that is living in Manitoba or maybe in Western Ontario would consider coming to Saskatchewan and moving their family here. We've got a lot to offer in this province, and that's why we want to make sure that our wages are competitive, and preliminary indication is our wages would be competitive with other provinces, if not a little bit better than other provinces. But again, we want to walk before we run with this. So,
Is there any, on sort of the medium term, is there any look at sponsoring seats at those educational institutions, like has been done in some of the other health occupations?
I would say that we're looking into it, and we would be supportive of advanced education doing that. But we want to make sure that we're focused in on getting these physician assistants in. If there is an opportunity in other provinces that we could sponsor seats, I would certainly support the Minister of Advanced Education in pursuing that. But that would be more of a question for him versus myself. I don't want to spend his budgetary dollars.
I think we can all agree that it's good to alleviate some burdens on physicians, especially as we hear about, some of the administrative burdens or what they're classifying as unpaid work under the fee-for-service model. I think the idea of that is really good. How many additional patients would you expect a physician would be able to care for when they are working in a team environment with a physician assistant? Because I assume that the ultimate goal here is to improve efficiency so that they can be responsible for more patients. Is there an expectation? Is there a number of folks that the ministry has forecasted that will be able to receive care using these 12 individuals?
Yeah, it would be tough to quantify it on efficiency. My focus would be on patient outcome versus the efficiency side of it. I think if we are seeing that patients are having a better experience in the primary care team with physician assistants complementing that with physicians, RNs, nurse practitioners, dietitians, physiotherapists as part of that team. I think the real test will be in the patient outcomes versus the volume of patients that they are seeing. And I think we will see some pressures come off of the physicians that are utilizing physician assistants or have the ability to access physician assistants. I think they'll be able to see patients at a higher level and be able to maybe spend a very focused amount of time with that individual versus doing all the general questions, which we've all been asked when we go in and see a doctor, of those questions where the physician assistant could certainly take that stress off of a physician and they can operate. So I think we'll see it in the patient outcome and the patient experience. So I don't want to put a number on it because it's going to also depend on the complexity of each case that's coming in. But I think you'll see a pressure relief from the physicians that they are not spending time doing things that they can have somebody else doing, and they're operating at the top of their scope.
Thank you. I have no further questions, Mr. Chair.
Thank you, Ms. Mowat. Are there any more questions or comments from any of the other committee members? Seeing none, we will proceed to vote on the clauses. Clause 1, short title. Is that agreed? Carried. Clause 2, is that agreed? Carried. Clause 3, is that agreed? Carried. Clause 4, is that agreed? Carried. Clause 5, is that agreed? Carried. Clause 6, is that agreed? Carried. Clause 7, is that agreed? Carried. Clause 8, is that agreed? Carried. Clause 9, is that agreed? Carried. Clause 10, is that agreed? Carried. Clause 11, is that agreed? Carried. Clause 12, is that agreed? Carried. Clause 13, is that agreed? Carried. Clause 14, is that agreed? Carried. Clause 15, is that agreed? Carried. Clause 16, is that agreed? Carried. Clause 17, is that agreed? Carried. Clause 18, is that agreed? Carried. Clause 19, coming into force, is that agreed? Carried. His Majesty, by and with the advice and consent of the Legislative Assembly of Saskatchewan, enacts as follows, the Medical Profession Amendment Act 2023. I would ask a member to move that we report Bill number 129, the Medical Profession Amendment Act 2023 without amendment. Mr. Nerline moves. Is that agreed? Carried. Minister, do you have any closing comments you'd like to make?
No, Mr. Chair, just thank you to the committee, thank to Ms. Mowat for, and thank you to my officials for being here tonight to support this great opportunity we have.
And Ms. Mowat, do you have any comments you'd like to make?
Yeah, just thanks for respectful dialogue and for everyone who's being here tonight.
Thank you, Ms. Mowat. This committee will now recess until 7 p.m. Thank you.